This is the second part of our episode with Dr. Karl Spiteri, who is a professional in elderly care.
Malta's future starts with a conversation. Idea talks.
Walk us through the routine, the daily life of Dr. Karl Spiteri. So, imagine you wake up early in the morning, and then what do you do?
So basically, as soon as I wake up and I go for a walk, take out the dogs, and then as soon as I switch on my mobile, I start receiving different messages from different people about problems that we encounter. And then basically I start meeting.
Because your job, your work environment really and truly never stops. It's not like an office whereby at 5, 6, 7 o'clock people just clock off, the office as empty. It's a 24/7 thing. So there are challenges happening throughout the night, and when you're not there, and then when you wake up, you find these challenges facing you.
Exactly, as in we have different, given that the allied health is very varied, we have different professionals working different hours. And as well, obviously, even though most of the allied health services, they are not there for the whole day, but however, the recommendations, they do have an impact on how care is provided by basically the other professionals. So there are usually impacts as well, and how the services are being delivered and how it will impact, and it impacts basically the life of the residents within the entity.
And is it a long day, or it's long working hours, or it depends?
Well, it varies depending on the issues at hand, and obviously depends. It varies a lot.
Very good. And what do you do when you are not taking care of the elderly? Do you have a hobby? What do you do? How do you spend your time?
Well, I actually enjoy doing some extra research as well. So I do enjoy doing some research projects as well. So I do like reading a lot about different ideas and the different getting new projects up and running as well. So
and a particular project that you're working on right now?
Basically, at the moment, we're working on. We have recently, basically, with the support of management, we submitted a very interesting proposal to basically have a digital system to screen older people in the community. We as well have something else. We have a colleague of mine who's basically working on something on early detection of dementia as well. And basically we're working as well on a retirement program, basically to promote the physical activity during retirement and as well assist people going through that retirement transition in getting over the change which retirement brings with it. So those are just a couple of projects.
Quite a handful. Artificial intelligence, what role is it playing now in elderly care?
So it has a big role, and it's the more time passes and the more we learn how to basically integrate it into our patterns of work, I think it will become more and more important. Recently as well, for example, I had a student who basically from IDEA who basically developed an AI project where basically she could predict the possibility of an older person from a community home who was sent to hospital to basically be readmitted into hospital.
Okay.
So using just data which is routinely done through normal blood works and normal history taking, you could predict the possibility of an older person who was living within an elderly home who was sent to basically emergency department admitted. When he's sent back home, the possibility of him being resent to emergency department and being admitted because his health problem was not dealt with, or he required further time within hospital. So that's something which can help us, how AI can help us improve the service that we are providing and making the service more personalized.
Okay. There is a lot of talk right now about AI and robots replacing humans, especially in healthcare, not least in elderly care. There were talks recently and even speculation, if you like, whereby it's being predicted that in the next 10 to 15 years, robots might replace carers. whereby every elderly person would have his or her own robot to conduct all the things that the elderly person might need in his or her daily life. Do you see that happening in a time soon?
So what I see is that there will be more integration of technology in our daily practice. I think sometimes we do limit the use of AI and technology to certain things which basically they are more, especially with this boom of AI, more with administrative stuff. However, I think, for example, I had another student from IDEA who basically looked at how technology can be integrated within same as in the poll. And she brought examples, for example, like issues having a robot who could safely transfer a patient from who is dependent, who basically from bed to an armchair.
Okay.
So basically reducing the occupational hazards which are associated with handling on nurses and on carers. For example, the dispensing of pills, so reducing the possibility of having medical dispensing errors over there. Having, for example, AI as well looking at prescriptions to ensure that we are abiding to standard prescriptions and basically flagging where there are issues over there. So I think I see it more as an integration process. However, I always think that it's always up to the professional to take the decision, and the human touch is very, very important. As in, you can have a pet who will basically keep you company, but that human touch, that touch, I believe, will still be very, very, very important in our care aspects. So we must not see technology as, okay, I have technology, I'm keeping the person there, but it has to be a symbiotic approach where the human touch continues, and at the same time we use technology to basically improve the quality of the care that we are providing and reducing obviously the possibility of errors occurring.
Okay, let me take you back to your childhood. Where did you study and what did you study?
So basically,
when you were young, which school did you go to?
So basically I started in St. Francis School.
Okay.
Primary.
Where? St. Francis?
It was in Slema.
In Slema, okay.
Then we went to Junior Lyceum.
Okay.
And then university, and Junior College and University. And then I went to basically doing my doctorate in Sheffield Hallam and Coventry University.
Okay, so you always studied sciences, I presume?
Yes.
Okay. And you give me the impression that you were a very diligent student. What type of student were you?
When I was younger, I was less diligent. Now, the older I got, the more diligent I became, I think.
Throughout your work, because you are dealing, okay, with your employees, but also basically, however, at the core of all this is the elderly person. Was there a moment in your career so far which you say, when you look back, that was the moment that was really touching for me, that was the moment whereby my perspective on elderly care changed, helped me look at things in a different manner? Was there that particular moment?
So, I remember when I first started working, I used, my first year of employment was at Buffa Hospital.
Okay.
And I used to work with basically cancer patients. And there were the palliative wards and chemo wards at the time. And I remember particular patients who, as in I was still in my 20s.
What was your job there?
Physiotherapist.
Okay.
And you could see people dying and experience it, people dying. And that's, I think, was one of the most enriching experiences for me. And it helped me as well, I believe, that experience to deal with the older person in a more holistic way and to deal with that in a much more, I could say, serene way, or rather seeing it as part of the life cycle. But I remember that first year was very touching, and it helped me grow a lot from looking at the person in a more holistic way, not just the physical aspect.
Was there any moment in time when you said, listen, this is getting too much, there is too much pressure, as in I'm constantly dealing with people who need constant medical attention and care. This is tiring me out. I need to work in a totally different field. In sports, maybe, as a physiotherapist, which I'm sure is more, you're dealing with a different type of patient.
So I think a mix is very good, and something why I always like to work within Nepal, but especially when I was a physiotherapist back then, was the fact that there was a mix of things to do. So you could see someone, a resident, and then you're seeing someone who is healthy and living in the community. Back then, you could go into the community, do health promotion talks. You could go and work within the homes, seeing elderly. So there was this continuous change. So when you're feeling that it gets to you, you're tired, you're seeing, a person is basically waiting to die sometimes, and you need that change. You have the change within the same institution. So that helped me a lot to remain basically always willing to work. And when you're feeling tired, say, okay, I need the change, and you get the change.
What skills are needed in the next 10 to 15 years for people, professionals, to work in this field?
I think what we need is basically we need to be able to integrate and be more. I think the center has to remain the caring aspect, but then we need to learn about technology, we need to learn about education, we need to learn about providing the specialized care, we need to learn to empower people, and so we need a mix of different things to be able to meet the future demands of older people. So I think it will become, in the future, I think elderly care will become more exciting because you need to integrate a lot of different specialties, expertise. But at the same time, at the core of it is that caring and looking at the person, and keeping the person at the center of basically what we do.
Okay, so you're 40, you have at least another 25 years before you retire. Do you see yourself doing this job till you retire, or any plans for the future?
I'll just have to see, but the job is so varied and different, as in my role is relatively new, so I'm still gearing in this new job. Then we'll see within the coming years what things come by.
Dr. Spiteri, thank you for your time.
Thank you.
That brings us to an end of our conversation with Dr. Karl Spiteri, a professional in the elderly care. I hope you found this discussion interesting, and till next time, thank you.